Welcome to the SolveForEarth.ai podcast, your gateway to the groundbreaking world of artificial intelligence solutions for the planet's most urgent challenges. From climate action to equity, sustainability, and beyond, we explore how AI is transforming ideas into impact. Whether you're ready to kickstart your passion project or want to stay ahead on global solutions, we've got you covered. Tune in, get inspired, and be part of the change. Listen, comment, and share because together we can solve for Earth.
Okay, so get ready to dive into a world where global health meets cutting-edge tech, because today we're tackling artificial intelligence for health.
And you might be thinking, hold on, isn't the WHO the one fighting pandemics and promoting well-being? What's AI got to do with it?
It's a good question, and to really understand it, we need to go all the way back to 2018.
Yeah, back when the World Health Assembly, that's the WHO's big decision-making body, released a resolution all about digital health with AI right there in the spotlight.
So what was the thinking there? Were they just jumping on the AI bandwagon?
It was definitely a pivotal moment for them. You see, they'd already recognized just how powerful AI could be when it came to their core mission, which is basically achieving the highest possible level of health for everyone everywhere.
So they saw AI as a way to achieve that ambitious goal.
Exactly. And they weren't shy about it either. They set this incredibly ambitious goal using AI to help achieve universal health coverage, especially for those who need it most.
So they weren't messing around. They were diving headfirst into the AI pool.
Exactly. And it was a bold move because they were trying to level the playing field when it comes to healthcare. Imagine a world where your location or income doesn't dictate your access to quality healthcare.
That's a powerful vision. But where do you even begin with something that big?
Collaboration was key right from the start.
Yeah.
They knew they couldn't do it alone. So they teamed up with another UN agency, the International Telecommunication Union, or ITU, and together they formed the focus group on AI for Health, or FGAI4H for short.
Catchy. Okay, so we've got this focus group, a mix of experts all gung-ho about AI and health. What were their first steps?
Well, first they took stock of the existing AI landscape in healthcare. They looked at what was working, what wasn't, the opportunities, the challenges, the whole shebang.
So kind of like taking inventory.
Exactly. And their second step was just as important, setting ethical and practical ground rules. They knew AI had to be developed and used responsibly for it to benefit healthcare.
So it wasn't just about building cool technology, it was about building it the right way. What did those early guidelines focus on?
Lots of stuff. Like, how do you make sure patient data is protected when you're using AI to analyze massive data sets? How do you address potential bias in algorithms? These were big questions.
It's like they were writing the rule book for AI in healthcare, a rule book they hoped the whole world would use.
Precisely. And they went all in. They organized the FGAI4H into 10 different focus areas, each with its own group of international experts. They called them pillars.
10 pillars. Wow, that's thorough. It's like they were building a solid foundation.
They weren't leaving anything out. And get this, they didn't just talk about it. They published some seriously important documents during that time.
Okay, let's talk about those. What were some of the key publications that came out of this focus group?
One of the big ones was their Guide on the Ethics and Governance of AI for Health, published in 2021. It was groundbreaking, laying out key principles for everyone involved, really, from developers to governments to clinicians, on how to make sure AI is used responsibly.
So this wasn't just a theoretical document. They wanted to make sure those principles were put into practice.
You got it. And they didn't just stop at publishing it. They followed up with workshops and training courses, really pushing for practical implementation.
So they were putting their money where their mouth was. What else did they publish? Did they address any other big issues?
Oh yeah, they did. In 2022, they came out with another crucial framework. This one was focused on generating evidence for AI-based medical devices.
That sounds serious. What was the thinking behind that one?
It was huge. For the first time, developers and researchers had clear guidelines on how to test and validate AI tools for healthcare.
So no more AI cowboys making big promises without any proof.
Not if the WHO had anything to say about it. They were serious. We need to make sure these tools actually work, that they're safe and effective before they're anywhere near patients.
Safety first, especially when it comes to something as crucial as healthcare. So this focus group sounds like it did some amazing groundwork for the WHO's role in AI and health.
It was a slam dunk. And you know what they say about success? It's not a destination, it's a journey. And their journey was about to get even bigger. The success of the FGAI4H paved the way for something even more ambitious. The Global Initiative on AI for Health, or GIAI4H, launched in 2023.
Ah, yes, the GIAI4H. From a small task force to a full-blown global initiative. What did this shift mean for the world?
Well, it showed that the WHO was all in on making AI for health a global priority. They were serious. And this time they weren't going it alone.
Oh, who else jumped on board?
This time they brought in the big guns. In addition to the ITU, they partnered with the World Intellectual Property Organization, or WIPO. Now you have 3 major UN agencies, each with their own expertise, joining forces. It was a powerful message about global collaboration.
The Avengers of Global Health assembled. What were they hoping to achieve with this new global initiative?
2 main things. First, democratizing AI for healthcare. They knew that the benefits of AI shouldn't just be for wealthy nations, it had to be accessible to everyone.
Makes sense given their focus on health equity. It's not enough to just advance AI for health. It has to be for everyone.
Exactly. And their second objective was closely tied to the first, promoting ethical and equitable advancements in AI for health. They knew that using AI in such a sensitive area could be risky if not done carefully.
So it's about pushing the boundaries of what's possible while being super careful and responsible about it.
Exactly. And that's why they needed a strong foundation, a solid governance structure.
Ooh, I love a good structure. Did they create one of those fancy organizational charts with boxes and lines?
They did, but more importantly, it laid out each agency's role and how their strengths could work together. The WHO would be the leader, developing guidelines and policies and encouraging knowledge sharing and research.
So they were setting the ethical and strategic direction. What about ITU and WIPO? What did they bring to the table?
ITU, with their tech know-how, were tasked with strengthening knowledge sharing on AI health and ICT policies. They also played a role in collaborative research, making sure the tech side of things was covered.
So they were the tech wizards, making sure everyone could connect. What about WIPO? Weren't they the intellectual property gurus?
They were critical. They focused on the policies around intellectual property and AI for health, making sure that innovation was encouraged, but also that everyone had fair access to these technologies.
So the WHO set the rules, ITU built the tech, and WIPO made sure it was a fair game. What a team. But they didn't just stop at the structure, did they? They had plans to put these ideas into action.
Absolutely. They structured the GIAI4H around 3 core functions: enable, facilitate, and implement.
Classic 3-pronged approach. I'm intrigued. Tell me more, starting with enable. What does enabling AI for health actually look like?
It's about setting the stage for success. Imagine creating the perfect environment for responsible AI to thrive in healthcare. So developing policies, guidelines, even laws to make sure AI is used safely, ethically, and effectively.
So basically making sure everyone is playing by the rules.
Exactly. This could involve things like standards for data privacy or ethical review processes for AI algorithms used in healthcare. It's about building that foundation of trust, transparency, and accountability we talked about. And once the foundation's set, you need to build connections right. That's where Facilitate comes in. Right on. Facilitate is all about creating a global network for AI in health. It means fostering knowledge sharing and collaboration, creating those essential platforms and networks for countries, researchers, and organizations to share their experiences, best practices, and even their failures.
So instead of everyone working in isolation, they're encouraged to share and learn from each other. It's about collective growth, a win-win for everyone.
Exactly. Recognizing that we're all in this together, working towards the same goal of a healthier future.
Which brings us to the final piece of the puzzle, implement. This is where things get real, right? Where the vision becomes reality. So how does this play out with the GIAI4H?
This is where the WHO and its partners got their hands dirty. They provided support to countries, empowering them to use AI solutions.
So it's not just talk, they're walking the walk with their partners.
Exactly. This could be anything from technical assistance to developing training programs to even piloting AI programs in the real world to gather data and improve their approach. The implement pillar is about turning those big ideas into actual improvements in healthcare systems around the world.
This is impressive stuff. It sounds like the GIAI4H hit the ground running. But can you give me some concrete examples? What did this collaboration actually achieve?
Oh, they were busy. In 2023 alone, they released several important publications that addressed some key challenges in AI for health.
Okay, so they're not shying away from the tough stuff. Give me an example. What were they tackling in these publications?
One that stands out is their deep dive on regulatory considerations on AI for health, published in October 2023. And this wasn't just a boring technical document, it was chock full of practical recommendations. Everything from transparency in AI development to managing risks, data quality, the importance of collaboration, you name it.
So they were trying to think of everything to anticipate potential problems and provide solutions. Who were they hoping would read this document and take action?
It was designed for everyone, really. Ministries of health, trying to figure out AI developers creating these tools, manufacturers bringing them to market. Anyone involved in AI for health could find something useful in there.
Like a roadmap for responsible AI in health.
Yep.
Okay, I'm hooked. What other publications did they release? Any other hot topics?
There's more. That same year, they also released another groundbreaking publication, Ethics and Governance of AI in Health Guidance for Large Multimodal Models.
Large multimodal models sounds impressive. Okay, for those of us who aren't AI experts, what are we talking about here?
You've probably heard of large multimodal models, or LLMs. They're like ChatGPT. They've been all over the news.
You mean AI that can understand and generate human-like text, hold conversations, write poems, even code?
That's the one. But when you bring LLMs into healthcare, things get even more interesting and potentially game-changing. These models can learn from tons of medical information, like medical journals, patient records images from scans, even genetic data. And they can use this knowledge for so many different applications.
Okay, now you're speaking my language. Give me some real-world examples. How could LLMs be used in healthcare?
Imagine LLMs helping doctors diagnose patients faster and more accurately by analyzing their symptoms and medical history. Or picture them generating personalized treatment plans based on someone's genes and lifestyle. They could even keep doctors updated on the latest medical research, sifting through mountains of information to find the most relevant stuff.
It's like having an army of super smart assistants working alongside doctors. It's both exciting and a little scary at the same time.
That's the thing. These are powerful tools with the potential to change healthcare as we know it. But they also come with their own set of challenges and considerations.
Like making sure these models are trained on unbiased data and used ethically so we don't worsen existing inequalities. Which is exactly why the WHO's guidance on LLMs was so important. They weren't just praising the potential benefits, they were also highlighting the risks.
Exactly. They dove deep into these complex issues, looking at the risks of bias in these models, how to protect sensitive data, and even how to prevent LLMs from being misused, either intentionally or accidentally. This is a crucial document for anyone wanting to understand how to integrate these powerful tools into healthcare.
Sounds like the WHO was trying to stay ahead of the game to address these ethical concerns before they became major problems.
Absolutely. They were being proactive, which is what we need with such powerful technology. But they didn't stop at publishing guidelines and frameworks. Remember, facilitating, bringing people together.
Of course. It wasn't just about reports, it was about starting a global conversation.
Exactly. And that's where their first major meeting for the GIAI-4H comes in. In October 2023, they held this huge gathering in Riyadh, Saudi Arabia.
Okay, a global initiative having its first big meeting. That sounds promising. Tell me more about this Riyadh gathering. Who was there? What was on the agenda?
It was truly a global event. It showed just how influential the WHO is. Nearly 400 people from 42 countries were there, some in person, some virtually. They were committed to being inclusive.
Wow, talk about global reach. So who are these attendees? Was it all policymakers and researchers, or was there a mix of people?
It was a fascinating mix of minds representing all aspects of AI for health. You had researchers pushing the boundaries of AI, policymakers grappling with the ethical and regulatory questions, and healthcare professionals, the ones who would actually be using these tools in their work.
So a real brain trust of AI in healthcare. I bet those conversations were intense. Did they accomplish what they set out to do?
It was less about checking things off a list and more about setting the stage for the future of the GIAI-4H. Think of it like a launch pad for collaboration.
A launch pad for collaboration. I like that. So what happened at this global AI health party?
It was a whirlwind. Dozens of presentations from leading experts, panel discussions on the most pressing topics, and even breakout sessions where participants could really dig into specific challenges.
Sounds like they covered a lot of ground. Were there any recurring themes or big takeaways that emerged from all those discussions?
One of the biggest focuses was identifying opportunities for collaboration, finding those areas where they could leverage everyone's unique expertise and resources to move faster.
So it's that teamwork mentality again, working together to solve these global challenges.
Exactly. It's about recognizing that we can achieve so much more when we combine our knowledge and resources.
It's not just about competing to find the best solutions. It's about working together to find the best solutions for everyone.
Right. And it wasn't all serious discussions and brainstorming either. They also hosted an ideathon.
An ideathon.
Okay, now you've got my attention. What exactly goes down at an AI for Health ideathon? Imagine a room full of brilliant minds, all buzzing with creative energy. Participants formed teams, brainstormed innovative solutions to big challenges in AI for health, and then pitched their ideas to a panel of experts.
So like Shark Tank, but for global health solutions powered by AI.
Exactly. It was a fantastic way to inject some fresh perspectives and out-of-the-box thinking into the mix.
Did any particularly awesome or unexpected ideas come out of this ideathon?
Oh, tons. There was one that really stuck with me, though. It was an AI-powered app designed to diagnose skin conditions using just a smartphone camera.
Wow, that's amazing, especially for people in remote areas who might not have easy access to dermatologists.
Right. Talk about using technology to bridge healthcare gaps. It was really inspiring to see.
It sounds like this Riyadh meeting was a huge success for the GI AI 4H. It's clear that the WHO is serious about leading the charge in AI for health. But before we get too ahead of ourselves, I want to pause for a second and bring it back to our listeners.
It's so important to remember that this isn't just about technology or abstract ideas. It's about improving the lives of real people.
Exactly. Because AI can seem kind of like this futuristic sci-fi concept, but when you talk about healthcare, it suddenly becomes very real, very personal.
Right. It's about our health, the health of our loved ones, the health of people around the world. So why should our listeners, no matter where they are, care about the WHO's work in this area?
It's a good question. What's the so what of all this? Why should we be paying attention?
Because it's about the promise of a healthier future for everyone. And that's something we should all care about. The WHO isn't just trying to make healthcare more efficient. They're trying to make it more equitable and accessible for everyone, no matter where they live or how much money they make.
It's about ensuring that everyone gets to benefit from the incredible potential of AI, not just a select few.
Exactly. Imagine a world where your location or your income doesn't determine whether you get a life-saving diagnosis or have access to cutting-edge treatments. That's the future the WHO is working towards, and it's a future we can all be a part of creating.
It's like they say, a rising tide lifts all boats. But in this case, it's a tide of innovation and collaboration that's going to improve health for everyone.
I like that. And the best part is this isn't just some far-off dream. We're already seeing how AI is making a real difference in healthcare around the world.
Okay, I love real-world examples. Give me your top picks. What gets you excited about the future of AI in healthcare?
One area where AI is already shining is medical imaging. Think X-rays, CT, scans, MRIs, things like that.
Oh yeah, I've heard about the algorithms are getting really good at reading those scans.
They're getting scary good. Often even better than human radiologists at certain tasks. Now what's really exciting is this isn't just happening in fancy hospitals in big cities. They're using this technology in remote clinics and communities that often have trouble getting qualified radiologists.
That's incredible. So we're talking about AI that can catch a tiny fracture a human might miss or spot a tumor earlier, giving people a better chance at treatment, especially in places that haven't had access to this kind of technology before.
Exactly. AI has the potential to completely change how we deliver healthcare, especially in parts of the world where traditional healthcare systems are hard to come by.
Okay, now you're talking my language. Give me an example. How can AI change the game in those situations?
Think about mobile health, or mHealth. In many parts of the world, more people have smartphones than access to hospitals or clinics.
That's true. Smartphones are everywhere these days.
Exactly. So when you combine that with AI, suddenly you can deliver pretty advanced healthcare services straight to people's fingertips.
Okay, now we're talking. Give our listeners a sense of what kinds of services we're talking about.
Imagine an app that can diagnose skin conditions just by analyzing a picture you take with your phone, or a chatbot that uses natural language processing to give you personalized health advice and information. These aren't things of the future. They're being developed and used right now.
That's mind-blowing. It's amazing to think that something as common as a smartphone could become such a powerful tool for health. But I'm sure it's not all smooth sailing. What are some of the challenges we need to overcome to make this vision a reality?
One of the big ones is making sure everyone can actually access and afford these technologies,
Yeah.
not just people in wealthy countries.
That's a really important point. It's great to have all this amazing tech, but it needs to be available to everyone.
Exactly. And that's why the WHO's focus on global cooperation and sharing knowledge is so crucial. We need to break down those barriers, share what's working, and work together to make sure these advancements benefit everyone.
It can't just be about making the rich richer. We need to make sure everyone's health and well-being improves.
Absolutely. And that's where our listeners come in. Because shaping the future of AI in healthcare isn't just the job of scientists or governments or tech companies. It's going to take all of us working together.
Okay, I'm ready to roll up my sleeves. What can our listeners do right now to be a part of this?
The first step, and this is so important, is to stay informed. Read about AI and healthcare. Learn about the ethical consideration, the potential benefits, and the challenges. We've talked about a lot of that today.
Become informed citizens. And don't keep all that knowledge to yourselves. Talk to your friends and family about it. The more we all understand about AI and how it's going to affect healthcare, the better equipped we'll be to shape its development.
I love that. And for those who are more hands-on, there are even more ways to get involved.
Like what? Give us some ideas.
Well, if you're tech savvy, think about how you could use your skills to develop solutions for health problems. We need people who can create AI-powered tools that improve people's lives.
So calling all coders, developers, techies, your skills are in high demand.
Yes, but it's not just about building cool tech. We need to build it responsibly.
Right. We need to make sure these tools are ethical, accessible, and designed to benefit everyone.
Exactly. And for those who aren't tech wizards, don't worry. There's still so much you can do.
Like what? I'm sure a lot of our listeners want to know how they can help.
Your voice matters. Support organizations that are doing great work in this area. Donate, volunteers, spread the word. Every little bit counts.
And don't be afraid to contact your elected officials. Let them know that AI for health is important to you. Write to them, call their offices, show up at town hall meetings. Make it clear that this is a priority.
That's right. At the end of the day, this isn't about technology, it's about people. It's about using our ingenuity to create a healthier, more equitable world for everyone. And that's a future worth fighting for.
I couldn't agree more. And on that note, we'll wrap up this deep dive into the world of AI for health. We've covered a lot of ground today, but hopefully you found it as fascinating and inspiring as we have. Remember, the future of healthcare is in our hands. Let's work together to make it a bright one.
Thank you for tuning into the solveforearth.ai podcast. We hope you're leaving with fresh insights and inspiration to take action and make a difference. Don't forget to follow us on YouTube, LinkedIn, and all our social media platforms for more groundbreaking discussions on how AI is shaping a better future. Together, we can drive real change for the planet and its people. Until next time, keep solving for Earth.